Hello and welcome to Ankimon. Let's get right to it. So we've got a Tyrogue versus Charmander. We're at level 14. Getting very close to powering up, evolving to Charmeleon. It's quite exciting. So this pattern here. Dependent. I'm not sure about this one. ARDS is springing to mind, but I'm not sure. Fat embolism, ground glass interlobular septal thickening, fat attenuation filling defect. Is that maybe that's it there? Not sure. Long bone fracture, IM rod placement 1 to 2 days after. Embolism to lung, brain, and skin. Rash, confusion, shortness of breath. Let's do that one again a bit. This is my nemesis. This one is low T1, low T2, myelofibrosis. Collagen proliferation in the marrow. Definitely cancer. This is pulmonary artery sarcoma. Not a pulmonary embolus. Expanding. Ooh. Paranoid syndrome. Is it DWI or flare? I'm going to say MET. I don't think a MET would necessarily restrict diffusion. I'm going to go DWI. Yay! Reasonably useful at differentiating between abscess and MET. Exceptions being some fungal infections and toxo. Necrotic MET having unrestricted diffusion. That's definitely erythema nodosum. But what's the rest of it? There's a whole lot of arrows going on here. Sarcoid? Yay! Typically distributed along lymphatics and are therefore seen along bronchovascular bundles. Interlobular septa. Major fissures. I don't understand this 1, 2, 3 sign. Oh, here we go. Bilateral hyalonodes, right paratracheal, and maybe that's it. Unsure. So that's a gallium scan. CT galaxy sign. Upper lobe mass conglomerate with nodules surrounding satellite nose. So I think that's the satellite sign. Oh no, that's aspergillosis with the air crescent sign. Unsure which one's the satellite sign. That looks like a galaxy. Maybe that's the galaxy sign. This is prune belly or eagle Barrett syndrome. No, it's not. It's Potter syndrome. It says it on the slide. This is where they get oligohydramnios and facial problems. Autosomal recessive polycystic kidney disease. 1 in 20,000 births. Disease of tubular ectasia and fibrosis that results in enlarged kidneys. Loss of corticomedullary differentiation. Low set flattened ears, short and stub nose, deep eye creases, micrognathia. Right, the tie rogue is nearly out for the count. Let's see if we can finish him off with whatever this is. Looks to be subpleural sparing, although I'm not sure about that. Crazy paving or PAP? I really don't know this one. Hypersensitivity. It's the head cheese pattern. Patchy ground glass, century lobular nodules. That's really key here. So at the centre of each lobule, you've got a ground glass nodule. And mosaic attenuation. Okay. Let's have that one again in a bit. This is the same one again. I must have already got stuck on hypersensitivity pneumonitis. Oh, this is another name for it. So hypersensitivity pneumonitis is the same as subacute extrinsic allergic alveolitis. I think that's the old name for it. The R build can also have some similar features. The century lobular ground glass classification specifically. I think this is just saying about the, oh yeah, there's a probability like normal, low probability, moderate, high, and the high probability is where you get the triple match. This is from Daynut. The yellow criteria. What is this? Haliverdon spats, or it's deposition of something, isn't it? Eye of the Tiger. Is it Wilson's? Copper? Or iron? Not sure. Iron, so it's not Wilson's, it's Haliverdon spats. Spasticity, progressive dementia. Pantothenate kinase associated neuropathy. Iron in the globus pallidi bilaterally. So that's necrosis, and that's iron deposition. Eye of the Tiger. Let's do good on that one. I want that one again. What's this? Looks like breast cancer. I'm trying to remember why I did this card now. So good predictive things. So CT is not really used for breast cancer, but you can pick up incidental breast cancers on CT, and a spiculated margin as well as axillary lymphadenopathy are the best, well, worst predictors in terms of it correlating with true malignancy. Genuine mass lesions, speculation, and non-dense breast, mammographic features of ill definition, calcification. Okay. Familial, this is cavernomas, isn't it? And they can bleed, and if they're bigger than a centimetre, they can definitely bleed. So cavernoma. Benign vascular hamartoma. Popcorn appearance, prominent susceptibility effect on T2 star. So they contain some, well, they contain bleeding, so iron. And the AVMs will demonstrate flow voids. Multiple black dots would make you think of amyloid. Less than 1 centimetre, brush-like, poorly demarcated capillary telangiectasia with post-contrast enhancement. Fat embolism. Okay. Regenerative, T1 dark, T2 dark. Dysplastic, T1 heterogeneous, T2 dark. HCC, early arterial phase hyperenhancement. Doesn't say with contrast, but I think it means with contrast. And then T2 prime. Hypointense with internal foci of isointense signal. Drop out in-out phase. Okay, hyperplastic, regenerative, dysplastic, HCC. That's kind of a better way to think about it. Oh, Tyrogue is down. Let's get him. Bosh! And we are not too far away from level 15. Lapras. Wow, I remember these being so powerful in Pokemon Go. I don't think I ever got one. It was one of the later seasons. I kind of quit after season 2, I think. Lapras. Wow. Alright, we've got Pyelitis, Emphysematous pyelitis, and Emphysematous pyelonephritis. So Pyelitis is just the collecting system, whereas pyelonephritis is also the nephron, so the kidney parenchyma. You can see it on a plain radiograph, that's pretty cool. Diabetics. I'm not going to read that out. This is actually pretty funny. You can't see it because of the overlay, but something about peeling an orange with one single front tooth. Anyway, pyelitis is just the collecting system. E. coli. Ooh, this is a good one. So, I don't know what the lead is actually. It doesn't really matter, but this is something esophageal spasm, diffuse esophageal spasm. Corkscrew. And maybe that's a manometer. No. I'm just thinking, like, where is that? Unimportant. Alright, that's my cards done. Now over to the big boy cards, the questions. We've got quite a few to go through, but it's okay because we just do one at a time. 52, investigated by MRI of the brain. Possible TIA. .54 female, seizure. CT brain, 2 centimeter hyperdense lesion in the right temporal lobe, which exhibits calcification. No enhancement. Mixed intensity on T1. Hypointense rim on T2. It's giving cavernoma. Ooh, -10 on the Lapras. I'm not sure how coded it is in terms of like fire versus water type, or whether it's just dealing damage. I did have this one battle against a Drifloon that took me like 2 days to get through. It's partly why I didn't want to stream, because this Drifloon thing was, I must have done like over 100 questions to get rid of this Drifloon. I haven't even heard of a Drifloon before that. 7-year-old boy presents with rapid onset proptosis. Right proptosis. Extracranial mass, right orbit irregular margins, intracranial and extracranial extension, decreased T1, increased T2, so it's a water cystic, and shows relatively uniform enhancement. Oh, I don't know this. Intraconal and intracranial extension. Rapid onset. Makes you want to go for ruptured dermoid, doesn't it? But I don't think it is, because that would be... dermoid would be T1, right? Because it would have fat in it. Rhabdomyosarcoma, because I know it's rhabdomyosarcoma from just memory, rote learning, but intracranial and intracranial. Decreased T1. Why does that make? I guess that's kind of more to do with muscle. Doesn't really explain it, does it? It just kind of says, "cause it is." This would be a good one for. So retinoblastoma are intraocular, not orbital, and less than 5 years. Common calcification arising from the retina. NHL, non-Hodgkin lymphoma, or National Hockey League. Doesn't fit. Predominantly older adults. Subacute. Capillary hemangioma, infancy, intense rapid enhancement. T1 iso, fluoroids. Okay, so I think I would have just reasoned that it wasn't any of the others, so it's a best fit, because you can exclude the rest. That's fine, so it's a deduction question. Head-on collision. Pain in both knees, so this makes you think PCL. Bruising of anterior aspects of the tibia. I should read the other ones, but Lapras is getting done. Halfway down. Neck pain. Weakness, paresthesia. 45. Neck pain, progressive weakness, paralysis in the upper limbs. Central intramedullary mass. Hyper intense on T2. No, I think it's Pendulum. Why is it? It's not a Met. It doesn't sound like a Met. It's not hemangioblastoma because there's no flow void or vessels. Astrocytoma, I would just have a feeling it's elsewhere, like not in the cervical cord. And then ganglioglioma, I don't really know what that looks like, but I don't think it looks like that. Centrally in the cord as well, that's a buzzword. Astrocytoma's eccentric. Peripheral low errors signal independent motor hemosiderin. Okay, 2 learning points there. Central location, hemosiderin deposition from hemorrhage. Ganglioglioma involves greater than 4 levels, but up to the whole cord. 75, man. Cemented total right hip replacement. Well delineated rounded focal lucency. Cemented bone interface. So it doesn't sound that bad, but I guess it's lucent. And it's progressive. It really doesn't sound that bad on this question stem, but well delineated, rounded, focal. (28) Asian male, low grade fever, weight loss. Post-primary, so secondary TB. Cavitations, pleural effusion, calcified would be. I don't know, but I'm gonna go with cavitation. Doing well today. So far, I haven't had any new questions, that's probably why. But that's why you put in the hard yards, because if you've seen all the questions, they can't surprise you, and you're going to get more correct. Well, I think I've done one new one. Lapras down to 20 HP. 9-month-old boy undergoes an MRI scan for investigation of severe developmental delay. Basal ganglia calcification and hydrocephalus. Oh, hydrocephalus, that's the buzzword for toxo. There we go. -8. Lapras, you're going down. MRI carried out for neurology service on a 30-year-old male patient. The most pertinent abnormality is of a thick, smooth meningeal enhancement following the dural arachnoid convexity. Following the dural arachnoid around the convexity. Mislaid the request. This is classic real life situation. 0 clinical details. pachymeningeal is this description. Dural arachnoid are on the convex defalx and 10th, without extension to beta ganglion ventricles. Which, if extended, would it be leptomeningeal then? (27) Female. Urgent neuro imaging following loss of consciousness as a result of road traffic accident. This is giving. What is it? Is it diffuse axonal or is it hypoxic? Giving DAI. This is quite striking when you see it IRL. Ooh, what have we got here? Guard spec. Great. I have no idea what that is, but we might be able to use it at some point. Let's find out. What can I use a guard spec prevents stat reduction for 5 turns after you. Nice. Dive deeper in AI mode. Degenerative spinal vertebral body end plane changes. I've learned that this is the modic type 1, type 2. So modic type 1, I think you just get I think type 1 is low T1, high T2. I think type 2 is high on both. And then type 3 is low on both. I'm not sure, but I'm going to see. Yes. Marrow edema, then fatty marrow changes. Sclerosis. Spot on. Okay, here we go. Now, in real life, if this happened, when I say no without any evidence of endoleak, does it mean you're just not looking hard enough? Because there's like at least 9 vessels, 8 lumbers, and then the IMA. And anyway, endotension, right? Or is that number 4? Alright, Lapras is fainted. Let's defeat him. Bosh! 53 XP to the next level. So, Talo. Once we're done with this Talo, which is kind of like a swallow, then hopefully we will destroy and get to level 15. Man cirrhosis, increasing shortness of breath, basal reticular nodule opacities, distal vascular dilation, subpleural telangiectasia. Shunting. I guess you want to follow this red cells, don't you? Don't know. Macro aggregated equipment scan. And let's have a look in the nukes section whilst they do that. Go albumin. Nothing. Shunt. Oh, here we go. Amazing, I've called it. Wow. I didn't know you could do that. This does look cute. This one's a banger. That's so helpful, isn't it? Just to see like a picture of it. Really, because reading the explanation doesn't really help you as much, but that's so clever. I do find, yeah, the techniques in Nuke Med are very clever. Just kind of a bit of a shame that I guess it's kind of underutilized by most referrers, so they just don't understand it. and it doesn't like spring to mind. Oh yeah, for like a Splununculus. Where's this one gonna go? 1, 2, 3, 4, 5, 6. Let's get in the other category. Okay, 22-year-old man presents with a 6-week history of progressive worsening confusion. Initial CT is normal. Following neurological review, the patient undergoes an MRI, to which the only abnormality seen is high signal in the posterior portions of the thalami. Ooh. JC, B. Left CP angle. Expanded meningioma. (62) Lung scintigraphy. Pulmonary embolus. C. Hurst syndrome. Hurst disease. Hemorrhagic hyperacute variant. Acute hemorrhagic leukoencephalitis. Hurst disease. Taylor fainted. Boom! Oh, what? We didn't level up. So close. Cacnea. Very high level for a cactus with a crown. Never heard of that Pokemon before. Let's lock in. Let's keep going. 55. Recent diagnosis. Multifocal HCC. Taste. A sounds true. C is false. I think D could be true. E's false. Maybe A is false because of the wording of proper antibiotic there. And yeah, I don't think it's an accessory, so I'm going to go with D. %. I don't like the wording here because that makes it sound like it's 2 arteries dividing, and it's just 1. $34 man, MRI brain, head trauma, subarachnoid hemorrhage, flare, it be iddy, so isodons on both. Proton density, no. T2 weighted, T2 with fast, flare? Flare or T2? I guess it's flare because you're nulling the CSF. That's how I was thinking at least. Okay, within the cisterns and sulci, so like intraventricular blood is not gonna attenuate. -10. That's pretty powerful. So we should be done with this guy in 8 questions time. Looking at MRI of knees of 16-year-old. Widening of distal haemophilia. Say no more. Previously followed. left-sided chest pain. Sats 92. D-dimer elevated. So this is like a really convincing history for PE. But imaging says no, therefore the answer is no. -10. Bosh. He's going down without a fight. 15, female, pelvic MR. 1.5 centimeter. This is a type of cyst. So scheme is near the vaginal introitus. Bartholin, Gartner. I can't remember the difference. Above the level of the inferior margin. So it's the one that kind of, it's like a mini bladder. Is it Bartholin? Oh no, it's Gartner duct. I wanted B to be B. That's really bad. Let's do a card on them. Is it GU or Repro? Alright, let's get this cactus. $60, headache, vertigo, ataxia, pain, weakness, left arm. Left arm for daily activities. Left radial pulse weak. Reversal of flow in the left vertebral artery. I remember talking through extensively why I thought this was thoracic outlet, and then seeing that bit and not really clocking. It's really annoying when they put the most key bit right at the end of like quite a long stem. Origin. So this is subclavian steel. Vertebrae basilar insufficiency. Headache, vertigo, ataxia. It is weird that it does that. Basilar. Like it's stealing from the brain. You'd think that the body would sack off the arm for the brain. But maybe, yeah, maybe it's not. Maybe it's anyone who's using it. Only -5 there. Hey ho. 32, female. Odinophagia. What is that? Different painful swallowing? Yeah, painful. No, can't remember. I think it's painful swallowing. So the myenteric plexus, presbyosophagus. Don't know what that is, or what chalasia is. That's good to know. Primary and secondary contractions are normal, so tertiary are the only abnormal ones. Shish kebab. 35, man. Tinnitus, hearing loss in the right ear. MRI of the internal auditory meatai. A 35-year-old man presents with tinnitus and hearing loss in the right ear. Expansile lesion, right petrous apex, without bone destruction. T1 and T2, so it's got fat and blood in it. I'm glad a lot of these are the Lindsay book, because I've really struggled to get my teeth into that before. It's tough, I guess. We just deal quite a lot of damage there and I didn't notice. Perhaps. 43, patient cough, sob, fever. Month. Bilateral consolidation. Peripheral. GGO. Middle and upper zones. Subpleural attenuation. Band-like subpleural attenuation. Upper zones. I don't know what this band-like subpleural attenuation is. Peripheral bilateral consolidation with upper predominance. Been going on for a month. Don't think it's. Oh, it's Loeffler's the acute. Oh, I don't know. I don't think this is right, but I'm just gonna go for that. What is Loeffler's? Simple pulmonary eosinophil, prominent peripheral transient. Let's do a card. We'll need a little break soon, I think. I think this is probably another deduction one, which I didn't really do very well. Pattern recognition, eosinophilic lung disease, match the time course distribution and stability. Subacute chronic, so yeah, the time was quite important. Bilateral consolidation, predominantly peripheral distribution, band-like subpleural attenuation. I didn't know what that meant. GGO in the middle and upper. Photographic negative of yeah, it didn't say that. Yeah, I got that. He's like asthmatic. Yeah. Interstitium. Peripheral blood. Eosinophilia. So yeah, what's the answer? Chronic eosinophilic pneumonia. Let's just have a look for that. Here's an interesting, well, just a bit of a different pattern, isn't it? So if we go quickly, COP being peripheral, antigen associated peripheral, 50% of patch. Upper lobe predominance is key as well. Alright, let's get this cacnea. And then I want to have a little break. Although I want to get, I've got 8 questions left. Let's see, Gartner, that's higher up. How can I remember that? I don't know. "30 male, A&E of head injury." This one's daft. Fainted, defeat. Let's level up. Are you ready? Level 15! Woo! Yeah! One more level until I think we can go to Charmeleon. That's exciting. Let's just find out in anticipation. How do I So what? It just does it. Evolve by leveling up. Oh man, now I'm excited. So we need to just get this blue bar from there to there, and then we get Charmeleon. Alright, 4-month-old baby is having a barium swallow done in your department for suspected reflux. There's no relevant past medical history. On AP view, you notice a filling defect in the mid-esophagus. Lateral swallows for RSS. Focal area compression anteriorly. Posterior, so it's a sling. Pulmonary left. Left pulmonary artery. Enjoy. Oh, -12 Trumbeak. 30 Caucasian. Bone marrow transplant. AML. Fever cough. Sensory lobular nodules of soft tissue attenuation connected to linear branching opacities. Multiple small sensory lobular nodules of soft tissue attenuation connected to linear branching opacities. No bronchial TB. So it was trying to describe tree and bud. Bronchial spread of TB. I did not get that from that description. Doesn't really say. I'll just do the pics and then man, CT, brain, sudden onset left-sided hemiparesis, clinical diagnosis of stroke. Enhance with the rounded. E. Child MRI brain. Defect of midline cleavage. What structure? Septum pellucidum's the first to go. E. '73 RTA head injury. 73 transfer, hypoxic, emphysema, smoking, puts him at risk of lung cancer. Endoluminal mass. Endoluminal. Paratracheal space. So endoluminal, endobronchial is SCC. Bit annoying they give the trauma history there. Like, it's just a bit weird, isn't it? Tracheal malignancy, SCC. Bosh. Alrighty. It's the head cheese pattern. Head cheese, subacute, HP, hypersensitivity pneumonitis. Central, yeah, central. I need to probably go over the lung anatomy again, the different patterns. Let's just get this Trumbeak down, 15 HP left. 34, woman, seizure, migraine, low mood, confusion, left-sided motor weakness. This is sounding a lot like MS. Convince me otherwise. Lupus. Oh my days. So it was the DWI. Small multifocal subcortical white matter. Okay. So I didn't connect the dots there. The DWI restriction, infarct. That's the key. see if we can find any good pictures of lupus. Not sure what will come up under, you know. Maybe thoracic, lupus. The endo, is it? Shows one about lupus. Let's just do this one, I guess. Yeah, I want a DWI to demonstrate the point. None of these are DWI. That's probably the best one, I think. -10, that's a good one. We're nearly there. That was a good question in terms of Not only have I learned something about lupus, but I've learned about MS not causing. MS does not cause restricted diffusion. Good to know. 73. Cognitive decline. CT brain, cerebral atrophy, dementia. PET CT. Early Alzheimer's. Reduced activity in the precuneus and posterior cingulate gyrus. Frontotemporal. Precuneus and posterior cingulate. I haven't got a clue here, but I'm going to go with B. I say I don't have a clue. I was thinking it's parietal lobe. Posterior cingulate gyrus. I don't know if that is. I think that's parietal lobe. Okay, let's get this Trumbeak. Come on, one more. 15 male, recurrent nosebleeds, nasal obstruction, MRI, pheno. This is giving juvenile angiofibroma. I didn't even look at the imaging findings, but okay. I'm gonna go and get a cup of tea. 500 XP further needed. Alright, a little break. There is a way to like pause the stream, but I don't really know how to. So I'm just gonna leave it on. And you can enjoy my recording studio. And then we'll be back for some more once I've got a cup of tea and had a little bit of a little break. I'm just gonna slide out. Okay. Seems my cat might have joined on stream. I don't know if you saw that, but let's get back to it. I'm gonna do another sesh, and hopefully we can get to Charmeleon. That is the game. That's the aim of the game. I'm not sure how that got muted. That must be the cat. No idea. It's going to be interesting and funny to watch back. Okay. Where are we? Ordon Village is the song playing right now, which is not on this album. Here we go. Let's do some more. Pachirisu. It's kind of like a different Pikachu. 50, so not juvenile Androphyroba. Invasive fungal Charizard. Oh god. 50, male. History of epistaxis, nasal obstruction, frontal headache. CT sinuses. Isodense soft tissue mass in the right maxillary antrum. Extension through the infundibulum into the nasal cavity. Bony remodeling. Isointense to muscle. Cerebriform. That can only be one thing. It's an inverted papilloma. Cerebriform. If it literally just said cerebriform, I would have got that. But it said a lot of other things as well. No bony obstruction with cranial polyp. Monster inflammation. Juvenile nasal Androphyroba. Nice. FES. This is functional endoscopic sinus surgery. I've got some Tim Tams here from Australia. My sister went to Australia. Got me some Tim Tams. Frontal recess stenosis. Between D or E. So let's have a think about this one. It's not commonly. So DNA in both alright, I think. Medialization of the middle turbinate. CT findings not common, is it? I'm gonna go with C. Because all the others. Hey. Bulgarization. Already yet? Didn't deal any damage. Let's go on to Peds next. Nystagmus ataxia. Oh, I did not know this at all. I didn't realise Chiari 1 was so... I guess 5 millimeters isn't that much, but it feels like a lot. Open spinal dysraphism, low-lying torcular. Whereas a Dandy Walker is a high-lying torcular. Relatively less tonsillar herniation. There's a normal. Clival hypoplasia, thin corpusculosum, tectal beaking. Long skinny fourth ventricle. Towering cerebellum. Interdigitated cerebral gyro. Neural tube defect, so it kind of just drags everything down. Sucks the cerebellum. Okay, let's do a little card on. Let's just do that, that's nice. And then I'll have a flick through the other ones as well, but that's really nice. Encephalomyelitis, meningio, and encephalocele. No, encephalocele. You have to be fast with these, otherwise they drop. A Chiari 3. I misread that as a Chiari 2. Okay, I might do another card on Chiari 2 as well, so I'm just going to copy this. This is really good. I don't know about that one. Actually, no, I think that is good for purity. That's fine, isn't it? Let's just get it across. Go back. Okay, here we go. 12-year-old, keen athlete, left groin pain, pelvis avulsion, ischial tuberosity. Thinking hamstrings. Sartorius is. It's not hamstrings. It's B hamstrings. Infant ambiguous genitalia, ultrasound. Hydroxyprogesterone. Between A and B here, but I think A is kind of looking at congenital adrenal hyperplasia, CAH, though I have a feeling, I'm not sure, I have a feeling it's a different hormone level that's raised with that, rather than, so I'm between adrenal glands and MR of the pelvis. I'm trying to think why you would need or why you wouldn't need an MR of the pelvis. Surely you'd need an MR of the pelvis. I'm gonna go with B, but I'm probably gonna regret it. Yeah, that's A. Yeah, 21 hydroxylase. That rings a bell. Not that 17 hydroxyprogesterone. Okay, so there's a deficiency that leads to that. Okay, fine. Let's see if we can find it on Endo. We just got it in time. That's an MO, isn't it? Alright, this one is going to go under pizza. Six-day neonate vomiting. So it's too early for pyloric stenosis. It's could be annular pancreas, windsock deformity, duodenal atresia, could be duodenal atresia. I think it's annular pancreas. It's duodenal web. Gosh darn. I can see this windsock, don't I? Might be under GI. Where's it not doing that? Here we go. Biliosemesis, double bubble with distal gas. That does look weird, doesn't it? Can't lie, I may have done questions on this before, but it's not ringing bells. I kind of need that in there, don't I? How do we do this? Maybe we just did it too. Male neonate, 38 weeks. ARDS. 36 hours of delivery. Giving meconium. Reduce lung volume, granular opacities. I'm not sure about this, but there's nothing. Oh my goodness. I'd swear down the granular opacities with meconium. Beta hemolytic strip. Let's go to the quizzer. This is a key quizzer one. So it is small lung volumes. That did make me think for a split second, but not much more than that. And gets pleural effusions. Okay. Let's go to the quizzer. Let's see if we can find beta hemolytic strip in the meantime. And you get inflated lung volumes because of the ball valve mechanism. Increased lung volumes. Pleural effusions. Post-term as well, and it was 38 weeks. Pleural effusions and reduced lung volumes. So actually there were a few things there which I probably should have got, but that's okay. As my music keeps stopping. Do you have an internet issue? I think we do. Back we go. 6-day-old dilated stomach, high-grade duodenal obstruction. Windsock. Gosh. Okay, next up is GI. We've had a few GI questions in there, which is fine. GI and then MSK, then GU. And we have nearly dispatched this Pachirisu. So So we'll get a little bit of XP soon. 24. Crampy abdo pain, diarrhea. A significant amount of weight. Reluctant to undergo endoscopy. Referred for barium meal, which showed narrowing in the gastric antrum. Antrum's the exit, is it? Cobblestone, mucosa, gastric. Cobblestoning, that's Crohn's, but I'm not sure. Yeah, let's go with Crohn's. Alright, see you later, Pachirisu. Bosch. Wow. Tropius. That's cool. It's bad boy. I don't know what it is, but it looks cool. It looks kind of like a palm tree. Tropius. It'd be cool if you could do some like info on them, but game. This is the person that made it. Pokemon. Wow. That's so really big. Where am I on here? How do I find myself? Muck meniscus. I'm pretty sure I've already got a trainer name or whatever. Recover API key. Where would I have saved that? Don't think that's right. Oh. Should I put my own name? Guess so. Oh well, you can change the... Oh, I might do that, you know. Should we keep Gen 2 as well? Yeah, I know a few of Gen 2, so let's keep them. Although, I'm going to lose Tropius. Should we try and destroy Tropius and then restart it? What was I thinking? I can't remember why I checked the settings now. Oh yeah, I want to get on here. I swear down, I'm already on there. Like, I swear I've done this already, so I don't know where that's gone. Unless it's in here somewhere. This is definite procrastination. Linitis plastica. Cirrus. Leather bottle stomach. Lymphoma mets, pancreatic carcinoma, inflammation, erosive gastritis I was aware of. AT surgical ward, 1 month after lecture. EVAR, nausea, vomiting. Adhesions? What's he had? He's had an elective abdominal. Yeah, maybe adhesions. Lad's bands, innit? So it's still working. Young man was involved in a fight. Fast food outlet. Stabbed and kebabbed in the abdomen with a large knife. Chest alveolar, duodenal laceration associated pneumoperitoneum. Inferior fluid. What other organ is most likely to have been injured? Pancreas. Liver. That's not far off then. I don't think that's going to be a good one to do a card on. Free gas just not reading it properly. Oh, I need to have a break soon. I think this is clearly fatiguing. But before that, we're going to try and do 10 more fresh questions. Tutti Studies. I thought that was my name. Okay, let's just try and register again then. It's not gonna like this, is it? I have a feeling I'm so gonna get hacked if I do that on here. Oh, here we go. Right at the bottom. So I've somehow got to link my account, presumably. I know that I picked a different sprite of Ash, so I don't know whether that's going to be the way I find it. The way to do this, I think, is to pick a very unique looking sprite. flex your Pokemon. No. On leaderboard credentials. So I need to check the Ankimon leaderboard is on in settings. Okay. Ankimon leaderboard credentials. Haha! Is that it? I can't remember my name. 2T_studies. Alright, I'm gonna sack off this Tropius and restart. And we're gonna pick up where we left off on MSK. You received your monthly challenge, Pokemon Snowrunt, a chilly challenge for January featuring Snowrunt. For more information on monthly challenges and to redeem higher tier prizes, we promise. Let's do that. And let's go Snowrunt. Challenge. Wow, look at that. We're up to 179th in the leaderboard. This is really cool though. So 22 Pokemon. Is that how many I've caught? Yeah, I think so. And what's this one? 22, 415. Level 4. Highest level is 22. Wow, this dude is... I don't have any shinies, I don't think. No. So if I see a shiny, I'll catch it. I'll break the rule. And I guess for now, we try and get up in the leaderboard. And I'm not sure how you do that. It's just based on... I think it's probably a combination of these, no? Must be some kind of... change my sprite. Choose trainer sprite. Doom, doom, doom. So the reason I picked the one with the hat is because I like my hat picture. But let's see if we can find any other hat ones so we stand out on the leaderboard and easier to find. Do 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 do. None of these are like screaming. That's quite cool. With Pikachu on. If I can pick one with a Charmander on. Or a Charizard, that would be cool. Someone's got an Eevee. What on earth is going on there? Ding, ding, ding. None of these are really jumping out at me. And to be quite honest about Pokemon knowledge, I am lacking. So I don't really know the significance of any of these. Remember Oak? He was like the professor. Professor Oak. These are kind of cool. Yeah, I might vibe one of these because they're Charmander, aren't they? Charizard, Charmander. Which one should we go for? That one? Or is that thing now? That one's kind of cooler actually. Ankimon, Choo-Choo Sprite. So we've gone for Pokemaniac Gen 3ers. I just want to see the rest of them. Ooh, that one's quite good, maybe. Not sure if I want an ash one though. Red. So many characters. Does make you wonder a little bit what, you know, just how much time and effort's gone into making Pokemon. Team Rocket. I remember them from the cartoon. It's pretty cool. Nearly at the bottom. Oh, it's kind of mad. So I've gone for the most Charmander Charizard-y one I could find. I think that'll do for now. Drop a comment if you think I should choose a different sprite like Team Rocket. But yeah, I'm thinking maybe Team Rocket. Definitely not Swimmer. Sightseer. That one's kind of funny. Yeah. We'll leave it as it is. Oh, I gotta find him again. What was it called? Maniac. I can't even find it now. Pokemaniac Gen 3. That does look pretty cool. Alright. Let's get this back in the corner. And let's take on, let's just do a few to get back in the flow. I've moved the XP bar. Hopefully so you can see the info at the bottom a bit better. Okay, it's back in the zone. Let's do another stint. 30 male bone marrow transplant, myeloid leukemia. High-risk CT, multiple centrilobular nodules, soft tissue attenuation, connecting linear branching capacities. don't see how I'd get that correct. I guess deduct. It's not that. It's not that. It doesn't sound like that because it's not like upload predominant. And yeah, primary. Having already got AML, you know, he's not going to get primary. So it's a deduction. That's loud. I kind of like it though. Let's see if we can turn that down. Cards per round. Pop up on defeat. Yeah, let's do that. That's just how loud they're going to be. Oh no, here we go. Let's go 0.2 because that was really loud. Alright, male neonate. And it's not meconium aspiration because he has got... He's not post-term. He's got pleural effusions. Pretty big ones as well. And reduced lung volumes. Is that going to happen every time I do a question? I think it is, isn't it? Let's turn it down a little more. I don't hate it, it's just it's a bit loud. Ankimon settings. .01. 0.1. Ding ding. Let's see what it's like. Oh, I didn't do it then. Maybe it's only every 2. Goodness me. I didn't read this one before, so 120 miles an hour. A combined speed to head on 60. Patient was wearing a seatbelt. Was not ejected. Intraperitoneal free fluid. Just beyond the ligament of Trites. The ligament of Trites is at the kind of DJ transition. Yeah, so it's literally the words just beyond that make it more likely jejunal. Anti-mesenteric proximal dredge. Bubbles of gas seen close to. That's better. It's not too loud. I think. As I get used to it, I'll anticipate it. Doom, doom. 30-year-old female runner. Just see what's coming on. Desktop audio, Anki audio. Yeah, we'll turn it down as well. On desktop audio, turn that down. Okay, I don't know if you can see what I was doing there. That was quite funny. You can see my mouth. 30 female runner. Pain in the legs. that, not that, not that. Shin splinter or stress fracture. I'm gonna go with stress fracture because periostitis along the muscular attachment. Periostitis along the muscular attachment. Why is it not showing me the leaderboard? That'd be why. $179. So I can catch more Pokemon, I can level up my trainer, I can catch more Pokemon, and I can get my Pokemon to a higher level. I don't think that's right, is it? Or maybe that's highest level caught. I'm going to catch. It's only at level 12. I'll catch the next one that's like high, and yeah, see what that does to my ranking. Okay, so the symptoms might not match. Ooh, what's that? Ah, I've been dealt minus, well, not my degradation of my attack by Ipon, who I think is some kind of like magic Pokemon, like magic type. 35 round sprains right ankle, 10 zany. Calcaneus. Sclerotic. Lipoma wouldn't be sclerotic. Enchondroma it's mostly lucent rather than sclerotic, I think. Simple bone cyst, normal variant. Let's go for bone infarct. Oh, I'm not doing well now. Usually asymptomatic, discovered. Central dystrophic calcification. I got that right. Just not typical for bone infarct. Okay, that's cool. Good learning point. That's why we do questions. MSK. Intraosseous lipoma. Okay, let's talk on this man. Let's just get back. Nice. Okay, probably only a couple of questions. A couple of questions away from defeating this Ipon. MR knee,
away. Painful knee. Lucent area of the wide zone of transition, the distal femoral metaphysis. Wide zone of transition. Aneurysmal bone cyst. Fluid levels, ABC. Don't think it fits with any of the other ones. Telangiectatic osteosarc. Okay. And the wide zone of transition? Narrow zone transition. Okay, these are the different types of osteosarc. Honestly, the depth of knowledge for this exam is just crazy. Quick. Telangiectatic. Terrifies me. Pardon my French. It's still so loud, I don't know why it's so loud. The battle noise. Okay, what do you say for this? The central calcification is an interosseous lipoma. Bony Bankart is like the avulsion from the inferior glenoid. Posterior humeral head indentation. Hey, that's literally what I said as well. It's nice when you get them right. Swear down. Has our icon fainted? Not yet, but we're on to GU. He has fainted. Defeat. Charmander's in 53. 500 XP is needed for the next level. Were we not on 50 XP before? And why has that changed colour?
when he's on the same amount of Paras. 40 uterine fibroids undergoing embolization. Which following statements? It's incorrect. Which of these is incorrect? See, I don't like these questions. The real exam doesn't have questions like this. Which of the following is incorrect? I think B is correct. I think A sounds correct as well. Very corkscrew appearance. I think that's true. That could be true. D. E. Ovarian artery supply to fibroids. It's more frequently found in women with previous pelvic surgery. That sounds like it could be true as well. Okay, so what's more than 5%? That's the learning point there. It's pretty niche. Let's just see what we're getting here for anterior division, corkscrew. They do bilateral, that's a good learning point. Delay embo for 3 months while meds shrink. Particles. PPH, gel foam glue. Okay, I'm not going to make a card there because I don't know what to make it on. I don't know how loud that was coming through. I've tried to turn it down, but in real life, that is loud. But it didn't do any damage to the Paris. 58 woman, bilateral breast augmentation, single lumen silicone gel implants. 20 years ago, presents a pain no less. It sounds like a rupture. And we're looking for a linguini sign, so intact extra capsular membrane, but linguini, radial folds, snowstorm. This song slaps. Mario's rooftop pool party. DJ cut. I don't want to add it to our likes. Let's add it to. Let's make a playlist. Change. Oh. Let's do a new playlist. Duty studies. So distractible today. 72-year-old man presents with a 4-month history of painless enlargement of right testes. Sounds like cancer. Uniformly though, hypoechoic. This sounds weird. I don't think it's epidermolysis because it wouldn't be painless. Seminoma, testicular mets, lymphoma, uniform, lymphoma. Yeah. It's those little words, uniform. Carney complex is the one that has Sertoli cell testicular tumours. It's an incorrect question, and it's D because it's more than 5%. Well, you get utero-ovarian anastomosis. Malakoplakia, leukoplakia, pyloura. What's the diagnosis? 56, female diabetic, microscopic hematuria. So she's peeing blood, but you can't see it. Multiple UTIs. Diabetics, keyword here. Standard urologist. Ultrasound, IV urogram. Not sure what that means. Whether that's a CT or a cystoscopy. Ultrasound is normal. Cystoscopy is yellowish raised lesions in the bladder. Leukocyte. Is that white or yellow? Malakoplakia, leukoplakia. Let's go for leukoplakia. There's my leukoplakia. So, leukoplakia is white. Malakoplakia is yellow. Indistinguishable from TCC. So I suppose in the STEM, the thing that they really emphasise the diabetic, which makes you think it's going to be more effective than a cancer, not pre-malignant. And let's just go. We're going to go leukoplakia. Imaging looks show neurologic defects.
Pre-malignant for SCC, not TCC. I don't love these nuke med questions. 45 male epigastric pain to the back. Amylase, so peritonitis, fits. Calcium, I'm not sure about that. Renal pituitary calcinosis, SIG erosions. So it's not of the cortex, it's the medulla of the kidney. Which I still get really confused with, can't lie, so let's look that up. There's a medullary in the pyramids? Renal medullary pyramids. Cortex is there. Here we go. This is good. This is very much a this or that one. Medullary nephrocalcinosis. So we are thinking this is probably hyperparathyroidism. MIBG, system review, protect the tape. I honestly not a clue. A. So
Systemibi. Pancreatitis. Okay. Some of these are tough. Tough questions. Yeah, I guess in that you've got to know what all 5 of those different nuke med tests are for, and the most common pathology of medullary, as opposed to cortical nephrocarcinosis. So yeah, I was on hyperparathyroidism, but then to think the next step, which is Systemibi, technetium-99 metastable Systemibi, is for identifying hyperparathyroidism along with the serum assay, which was, yeah, I didn't know that. I do now. That's why we do this. Lot to learn. Okay, just do this one more and then go for a little break. But I'm on a good flow today, so I'm gonna try and just keep going. As he fainted. So we're gonna get rid of that deck. I'm gonna do Sim again on the next deck. CNS, Peds, GI, MSK, GU, cardiothoracic, final. Paris has not fainted. I want to just get rid of this Paris. Doing the CT head of a 49-year-old woman, and you notice she has a subarachnoid hemorrhage. Perianeurysm. Trauma. Of course it's trauma. Most likely it's trauma. 64, man complains of pain in both legs, indigestion, vomiting. We just did this. Systemibi. Please be Systemibi. Methine. Oh no. PET CT. Adjunct. PET CT is more sensitive. Systemibi is still NHS best. However, PET, if PET is given, so methionine PET is better than Systemibi. Some questions you're just not going to get, and that was one of them. So the best sequence for MRI to epidermoid and arachnoid, that would be DWI. Yes. I'm getting better at these MRI head questions, or MRI questions in general. 54, man, MRI spine. Serpiginous structures outside the cord. Makes you want to say AVF, but it's outside the cord. So is it dural? It's not spinal AVF then. Dural AVF? Nice. Don't think too much about that. Fainted! Let's get the Paris. Wow, fluffy. Did that say 500? Yeah. Oh no, we're going up. XP bar is going up. Maybe it's just 500. I don't know. 58-year-old man presents with 2-year history of painless palpable swelling as left parotid. Ultrasound shows it to be mobile and superficial to the facial nerve. Painless palpable swelling. Thinking warfarin. That was so loud. -1. I've never seen that before. Huh? Does that mean there's like another one coming? Must do. Peas. Alright. I'm gonna go pee. And then we're gonna carry on. And just check the leaderboard. See if it is 179. I think I might catch this fluffy and just see what I got on. I didn't want the Paras, but I'm still 179. I guess I'm not really. Yeah, I haven't leveled up. That's the. I'm not caught anymore. So if we catch the fluffy and then see what happens. Okay, when I'm back, after I make another cuppa, we're going to catch the fluffy because that will also be the highest Pokemon. Sweet. BRB.
more. I'm getting a bit cold. I don't want to turn the heater on because it's too noisy for the stream. I'm going to, just eat my lunch and do a few questions. And we'll try and catch this fluffy. Oh, chilly. Very cold. December weather. January weather. 96 days till the exam. Not long to go. Can we get the Charmander? Oh. I've got to crack the core here, and I'm gonna do more using crack the core soon. And I've got this. I've got a desk camera, and I'm hoping to do some videos using this desk camera, which I'm going to call cracking the core, where we go through every single page of this book along with all the slides, and then we do it with book number 2 as well. This is going to be a lot of fun. A whole lot of fun. Right. Alright, let's look at Fluffy while we eat. 3-week-old boy with reading clinic, diagnosed with heterotaxy. Total anomalous pulmonary venous return. I think spleen. So I think you get cardiac anomalies in both. What was that? The dog or a dog? A running dog. So we've got left-sided, we get polysplenia, because obviously the spleen's here on the left. Whereas if we get right-sided, we get asplenia, because there's no spleen on the right. Right is worse. So if you think left side of the heart's the strongest side of the heart. Oh hey. So much noise going on right now. My cat. Right, 4-year-old boy brought into ED by his parents. They report
He fell over backward off their sofa and hit his head. Most suggestive of NAI. Distal radius, clavicle, femoral. I think parietal, surely a skull fracture. Ooh, hello. Do you want to say hello to my cat? You're on stream. This is Jess. Hello. Say hello, Jess. She doesn't know she's on stream. And she doesn't much like being on stream either. But she does want my lunch. And she's not getting my lunch. Naughty, naughty. Smells good, doesn't it? I'm sorry, Jess. But you can't have any. Okay, I'm not reading into this one too much because if you're parietal bone fracture, I don't know. Spiral fractures, significant power. Scapula, posterior rib, sternal, skull, non-pride. Okay, fine. Sequestration. Let's make a card on that. Millipedes wandering around, aren't they? If Charmander can't move, does that mean he can't attack? I'm not sure. Big pains in the leg. Osteoid osteomas cause pain. Spiral. Femoral spiral. Still dealing 10 HP damage, even though he can't move. I wonder how long would paralysis last. Fair-haired 6-year-old boy undergoes a CT chest for further investigation of recurrent chest infections. Fair-haired. So cystic fibrosis. Doesn't actually say that, but I think Northern Europeans get cystic fibrosis more frequently, hence the fair-haired thing. Let's just do these two. Serum parathyroid and patecnetate. System B. Not patecnetate, system B. Trauma. Bok Dalek hernia. So we've done CNS, we've done PEDS, next is GI. Reporting a CT scan of the 70-year-old woman. There was a mass in the body of the pancreas, so body, that's key. Body's right in the middle, which is 70. Calcification, so stellate, so serous cystadenoma. There's 5 types of choledochal cysts. 5 too many. Three days after liver biopsy. Jaundice.
Probably MRCP. Hemobilia. What's Margil? This one's a banger. Kind of makes sense, but I've never even heard of it. That's why you do questions. Stuff that ain't in the textbook, but that you can kind of work out. What I don't get is why it's saying an AV fistula. This is quite a good one. Quick triad. Axial pre-biopsy, the axial post-biopsy. There's a little defect there, and then there's contrast enhancement. What are we looking at? There's some swirliness. That's the thing they biopsied, right? I don't know. I don't know if these are particularly good to demonstrate what's going on. Yeah, the duct is slightly different density, but so what? Okay, let's take one of these images. This is pretty good. I like this. I'm not really sure what that's showing. Let's just do this one. And then maybe the radiopedia one. low yield. Someone to chill, Jess? I didn't think so. Okay, we can do that. That's fine. Just need to show like the density is slightly different. And the dogs. Fluffy is going down, I'm telling you now. We're gonna get this Fluffy. CT scan of a 45-year-old man. Rib fractures, 1 kidney. See the cat? Don't know if you can see the cat. Ah, splenosis, that's it. I can't remember what that was called before, but sulfur-colloid splenosis. Which of the following combined to form a common bile duct? Hepatic duct and cystic duct. That's the easy one. Woo! Fluffy, you're going down. 30-year-old man complains of severe adenophagia, painful swallowing, barium, abnormal esophagus, apparent esophagitis. It's not an upper. It's not that, that's herpes, halo. Nope, not that. Reticular mucosa pattern and distal esophagus. Doesn't actually say the answer, does it? Okay, we've done 5 GI. Next up is MSK, then GU, then cardiothoracic, and then final. Man, chronic left hand pain and swelling. In addition, he has complained of right elbow swelling. So they're thinking polyarthralgia, MCP and IP, metacarpophalangeal and interphalangeal. Uric acid is raised, so gout. Juxta articular erosions. Dual energy CT. Oh, dual energy. Ultrasound. Ah, CT. Dual energy CT. Tophus burden. Uric acid. Where is this question from? Can I
see if I can flip. Yes. All right, now we can see whether. Oh no, what did I say? I said we were going to catch the fluffy, didn't we? Because then it's a higher one, and you caught a wild fluffy. If I go sync, and then if we wow, we got an unknown. Is that an A? That's sick. That's so cool. I want to catch that one as well, which is going against the plan. I'm gonna move this up as well. Okay, TT. Come on. Here we go. Still 179. Ah, it's not updated that way. Unless it doesn't count on 22. I'm pretty sure that was on 22 before. So let's see if we can. Okay, let's just check back in a little while. And it's unknown. I'm going down the Pokemon rabbit hole a bit too much. Alright, I'm gonna do it, like, yeah, whatever. Let's catch the unknowns. Well, let's at least try to catch the unknowns. I think this is an A. Kind of looks like an A. 28-year-old man with previous left anterior shoulder dislocation requiring assisted reduction was referred by the orthopedic surgeon for MRI shoulder to assess the cause of shoulder instability and characterize the labrum. Let's say internal, external.
Let's see what we can find on the MSK. There have been quite a few questions on this, so I'm going to do one. That makes sense. If you're, you'd lie them flat, and then if you do that, you can feel more of a gap, because if you do that, it kind of closes it. So yeah, it makes sense. What is that? Right, on to the next. 35-year-old male patient presented with painless right knee swelling over the past 5 months with no history of trauma. Painless right. Okay. I haven't got a clue. Split fat sign. Makes you want to get lipo, doesn't it? Liposarcoma. That's why we do the questions. Lympholic undifferentiated sarcoma plus. Man, car accident. High speed into a wall. Why did we destroy him? Deviation of trachea to the right. It is remarkably stable. Hey, movement. Yes. Traumatic aortic rupture. How on earth is he so stable? And why is this question in MSK? I guess trauma and orthopedics. That is incredible. How is he still alive? Right. Supine external rotation. This unknown does not seem to be taking any damage. UV MRI scan of a 50-year-old patient with carpal tunnel. No, I think we said that, don't we? So it's the flexor retinaculum and the carpal arch. Sestamibi. Parathyroid. It's not working. Weird. CT angio for this person with haemophilia. Urology MDT, 65-year-old man has been diagnosed with prostate cancer following transrectal ultrasound biopsies. His pre-procedure MRI is to be discussed at the meeting. Pre-procedure MRI. So it's low T2. Or high signal DWI. High signal DWI. Low ADC. High signal DWI. Low ADC. I suppose that's why, because you could get T2 shine through. Just check the rest of the slides. Oh, we actually dealt some damage to the unknown. So it is destroyable. It's susceptible. $49. Left breast lump. Triple assessment. Lovely carcinoma. Left upper outer quadrant. Internal mammary nodes, isn't it? Auxiliary they can do, but not internal mammary. Doesn't specifically say on this. Yeah, I'm just gonna chalk that one off as a think about it more. Presence of an additional lesion in the left lower outer quadrant. Go to a few more breast MDTs, I guess. 38-year-old woman undergoes an abdominal ultrasound for investigation of an intermittent flank pain. Within the left kidney, a 3 centimetre, well-defined, brightly echogenic, suggestive of a renal angiomyolipoma. Spontaneous hemorrhage, size greater than 4. Come on, it's got to be. Okay, this unknown is going down. Low ADC. As a party tumour. hematoma, intratesticular cyst. Non-specific abdominal pains. As a body tumour, why not? Yeah! Burnt out germ cell tumour, yeah, that's it. Nice. Minus 14 HP. Which of the following findings will most likely contraindicate wide local excision? Additional lesion in the left lower aorta, as well as the left upper aorta. So there and there. Raise PSA. Which MRI sequences? I feel like this is difficult. Okay, so we want T2 because we want to see whether it's restricting diffusion, and I think that's the T2 sequence. Oh no, we want DWI. So many sequences here. T1 is for anatomy and hemorrhage. T2 is for Mets. Sagittal coronal dynamic contrast enhance. I think you need axial coronal if you're going to pick two, so let's go for the middle one, C.
I got it wrong. It was this one. Need 3 plane T2. Pyrads. Yeah, DWI is essential for Pyrads. T1 also useful to look for hemorrhagic foci. I wonder why that is, because maybe it's like a multiple of it, right? Or yeah, it's 1 over square root, so it's going to be emphasized. Focal loci glomerae. So here, the answer was that you need 3 plane T2. That was it. It does take me a long time to do questions. That can't be denied. '73, pacemaker, bradycardia. The leads traverse the cardiac shadow, parallel to the left side of the spine, and then go back up across the midline. Left side of SVC. Caught the unknown. We got an Elekid. I love this one, and Electabuzz as well. I don't think we'll be collecting him though, just cause I want to get to Charmeleon. That's going to be the goal from now on. I think, even though we have gained more Pokemons, I've still not seen this jump up the, and this hasn't changed, so I've definitely caught 2 more since then. So I wonder if we can just find out when the leaderboard.
You'd think Unlucky Life would be on here. Maybe that isn't him or her. It's caught for you. $36. That sounds like a Charizard to me. Alright, let's stop banning about. Let's get these done. 77. MRI. Nephrogenic systemic fibrosis, which the following represents a minimum cut-off 30. Gadolinium. Yeah, I've got artery angle over 19, neck angle over 150. Common head diameter, that's fine. I think it's the 7mm length of the common iliac. I've definitely seen this question before. It's a get through one, isn't it? No, you got crap. Just checking to see if my cat's being woken up by all the sound effects. You're assisting with a lung biopsy for a suspected malignancy. Mortality rate for lung biopsy 0.0005. A. Ovarian dysfunction. In the world of interventional radiology, uterine fibroid embolization is gaining momentum. An Elekid is going down. Recurrent optic neuritis makes you think MS, waxing and waning. Acute MS. Which of the following is not acute MS? Black hole appearance. Only Mass Effect. Black hole appearance. That sounds quite good to me. Let's go for black hole appearance. Periventricular white matter. Is this not the... Oh no, this is final. This is just a mix. Get through, this is the chin book. Let's see if we can find black hole. Medial thigh pain. AP and lateral X-rays of the knee and femur. Arc normal. Meniscal. MRI. Oh no! Frog-leg lateral. Sufi. Knee pain and limp. Medial thigh pain. I read that as medial knee pain. Right, that's not a problem. But it's a problem for you, Ella Kid. 30, woman, presents with shortness of breath and fatigue. Sounds like pulmonary hypertension or VSD. Yeah, VSD. No, ASD. Shunt reversal. Eyes and mega. Gosh darn, I've seen this in real life. And it's pretty gnarly. Why is that not coming up in through? Maybe in peds? Cardiac. Yeah, I've actually seen this, like exactly that vignette. Actually, it's really incredible. She had a, I think it was the doctors. One of the something was patent still. That's VSD. This is a nice one. Yeah, I can't remember what vessel that is there, but there's another one on here. Anyway, it's pretty cool. If we go, it's not Santa, it's Coronal. I've never seen it like this before. You see how WordPressy it is though, because it's just like a free text box. I never knew it was that. Manual, wow. Wow, it's really manual. Scarf changes. I'm kind of shocked because I did not realise quite how manual that was. Anyway, I'm going to get over my shock very quickly and just take some images. right atrium. And it's not just the 3 chamber mass, it's the left knee pain, limp, medial thigh pain. And we're going to do frog-led laterals because I think it's got Sufi. Central ulcer with an amount of edema. I'm nearly done. Common meniscus. Wow, look at that. That's pretty cool. Aren't many that I've never heard of. Okay, we want to get this Charmeleon done today. Let's go! ADC, ISO intense, low, 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 low. That might be the Elekid, that might be it, that might be. Okay, I know this is a synovial sarcoma, so I'm going to reread it. Traps to articular, that's key. Calcifications. Denser in the periphery than the centre. Multilobulated juxta-articular lesion. With heterogeneous signal intensity cystic components on T2, ISO intense on T1, ISO intense kind of muscly sarcoma, with subtle non-continuous high signal intensity 9 split fan sound along the peripheral aspects of the lesion. Heterogeneous contrast enhancement and malignant. Yeah, we've not got that. synovial sarcoma, we know it now, the split fat sign. Let's see where that whole exam prep. People don't give FRCR exam prep much rating as a question bank, myself included, but that was a pretty good question in terms of like the imaging findings. And here we go, we've got a Pyradzi Axe Sag Coronal T2. What was this one? Same again, FRCR exam prep. He's fainted. We are going to defeat him. $382. So we need 118 XP. Okay. ASD. Eyes Mega Shunt Reversal. Voltorb. I am enjoying it more now that I'm doing battles against Pokemon that I know from the OG Gen 1 and 2. Okay, I've got to find some resolve here. Done a lot of studying today. 142. 143 cards. 2 hours. I've been here for way more than 2 hours. The stream will attest to that. Okay, let's sync, check the leaderboard, see if it's updated. Do that one, and then still 179. It's okay though. It's okay. I don't care. It's the common meniscus sign. Okay, this one's going fast. See you later, Voltorb. Peds, MSK, mixed. We'll leave mixed to the end like we did before. Alright, I like this. I like this deck. What is this deck? This is done. Not tagged. Okay. 65, diabetic, dysarthria, right sided weakness. So stroke. Left parafalcine. Frontal blow. ACA. If it's medial, it's not going to be the MCA territory. Left-sided nystagmus. Is it relevant that she's a fitness instructor? Left superior part of cerebellum. Vermis tectum. Vascular territory. Superior cerebral artery. Left superior cerebral artery. '68, male, no psych history, declining memory confusion, memory confusion going down. '68. No previous psych history, declining memory and confusion. Patchy low density in the deep white matter with marked generalised atrophy. In a small well-defined areas of low density.
Much like Mass Effect. Sounds like small vessel disease. Someone say Alzheimer's and small vessel. B. Those are like the same. Grr. "61 woman, gradual loss of visual acuity in the left eye. Left-sided proptosis. Tram track calcification. So I'm between C and E. Gonna go with E. So the reason I went for that E was the gradualness. Tubular thickening as opposed to fusiform. Okay. Cool. See you later, Voltorb. 35 man tinnitus, hearing loss. Right ear. Expansile Petrus apex without bone destruction. Cholesterol granuloma. So many questions about this stuff. Okay, we've done head and neck, CNS head and neck. Next is peds. Colicky abdo pain, purpuric rash on legs. Abdo pain, rash on legs. I think extensor surface is the wrong one. So far it's just sounding like eczema. Purpuric, I'm not sure what that means. Colicky abdo pain, colicky, maybe renal stones. Urinalysis reveals hematuria and proteinuria. Proteinuria is concerning for something more than stones, like a acute tuber nephritis. Hyperechoic kidneys. Bowel thickening, terminal ileum. What is going on here? Terminal ileitis. Crohn's. Hemoxin purpura. That can definitely mess with your kidneys and with your skin. I don't think she's got hemolytic uremic syndrome because that would give like bruising from low platelets. So yeah, let's go HSP. Yes!
small vesicle vasculitis. Ugh.
Upper respiratory tract, glomerulonephritis, IgA. A neonate born at term is reviewed on the postnatal ward round for not tolerating feeds. Every feed is regurgitated, and he's drooling. No respiratory. Okay, so it can't pass an NG tube, so it makes you think of a tracheoesophageal fistula. Every feed is regurgitated. Maybe it's without a TOF. Yeah. I think it's C. Doing good. These are tough questions, and I just got it. And I'm on a run, so yeah, good job. 20-week antenatal ultrasound, unilateral fetal hydronephrosis. Renal pelvic dilatation. One-sided. I'm gonna go with E. Yeah, that wasn't, particularly clever. It's just a poorly written question, I think. Nearly done with the Voltorb. Just got these two to do. Number one from Peds anyway. 2-year-old child presents with abdo swelling, large mass, right kidney, encasing, neuroblastoma. Encasing neuroblastoma. Encasing neuroblastoma. Wilms is invading. Painful right knee. 5 years old. Painful right knee. Perthes maybe. Distal femoral, no. Sunburst, that's bad. Yeah, I'm gonna go for B because I can't be bothered to read C, D, or E. And it's D. Done a bone. You're gonna look that up. You're just gonna look it up, aren't you? That is the reality. Wow, I've been streaming for 5 hours.
That's kind of mad. This is a good old study sesh. Okay, let's keep going. We've only got 1, 2, 3, 4, 5. 25 questions left. And hopefully we'll get to a Charmeleon as well. So, we've done Peds, we've done CNS. Next up is GI. This is sounding a lot like pancreatitis and not bowel obstruction. Sentinel loop sign. Localized paralysis. Oh wow, there we go. Focal ileus. Sentinel loop. Associated with pancreatitis. Or any inflammatory condition by the looks of things. Okay, we've got probably one more Pokemon to kill. One more Pokemon to battle before we level up, which is getting quite exciting. That's a Meowth. Team Rocket's Pet Cat. 54. Persistent abdo pain fever. Normal amylase, colon, silver, endoscopy. Got thyroid disease. Well, it's got fever. Is the thyroid to do with being hypothyroid and therefore having constipation, therefore having diverticulitis or recurrent bouts of some slow gut thing? Sclerosing mesenteritis. See if that's in the thing. It is. There we Misty Mesentree. Yeah, and I wonder. So I was wrong. I was wrong with that train of thought. But right at the end, so it's cool. And she's off. The cat's going. Even she's bored. Meow. What a noise. Okay, let's focus. Let's lock in. One by one. We got this. 50. Well, I need some upbeat music. It's getting me down now. This piano. Let's get back to the original Pokey and Chill upbeatness. Play the song. It's just not having it. I think my internet is just horribly slow. Let's go. A 50-year-old woman been treated for cervical carcinoma 18 months previously, presented with colicky abdominal pain. CT showed thickening of the ileal wall with luminal narrowing, which was causing partial obstruction. Increased attenuation of the mesentery. Cervical cancer. Radiation enteritis. Fits. Bosh. Look at that. Alright, we're gonna get this Meowth. We're gonna get this Charmander. It's gonna happen. This has been a marathon session, but we're nearly there. Alright, 50 male, 2.5 centimeter HCC, and goes radio frequency ablation. Uncommon. Uncommon. That's normal. That's normal. That's not normal. I guess so. Yeah, definitely. Neutral. Sure. C. 34 presents to. Oh, sorry, third question. A patient presents to A&E with severe upper abdominal pain. 4 days following barium enema. So far we've got large small bowel and duodenum inflammation. Linear low attenuation. Extended from the pulpit into the liver parenchyma. These do not extend to the margin of the liver. Alright, I'm gonna go stop that noise. Let's have a think about that. Cats on stream. Alright. Sounds like air, doesn't it? If it's -1. Wait, how can it be that? Post enema. Four days ago and there's still barium in the rectum. I want to say perforated duodenal ulcer. Nope. Cholecystoduodenal fistula. Cholecysto, so gallbladder to duodenal fistula. Air in the portal air. This is describing pneumobilia. Perfect. Okay, GI done. We are now moving on to MSK. (55) Female, pulmonary sarcoid, pain in both hands. Atypical skeletal. So you mentioned 4 findings of skeletal sarcoid. Great. Lace-like pattern of bone destruction. When I hear lace-like, what do I think of? I'm not sure. Bone erosion, joint space narrows, like radiolucencies. Between bone erosions and lace-like bone destruction, but I don't know which of the two. E or B. Erosions is just classic of psoriatic, so I'm going to go with C. Alright, great. Preserved joint space. Not only is sarcoid pretty uncommon, skeletal sarcoid is very uncommon. Minus 5 HP. I'm so close. And yeah, so far. Chondroblastoma. That's the chondroblastoma. I think the osteoblastoma. I want to say 10 to 20. Female, proximal humerus. Proximal tibia. Internal calcification. Florid marrow edema. (56) Female. Stiff. Pain. Hands. Marginal erosions. Okay. Dun-dun-dun. We're close. 55 female pulmonary sarcoid. Pain in both hands, but no joint space narrowing. And now we know. 42-year-old pain. Acute abdominal pain. CT. Meningioma level 1. Vertebral body hemangioma. Okay, here we go. It's happening. It's happening. Evolution. Hey, we have Charmeleon. Oh, yes. We are arguably halfway to Charizard already. Wow, look at that. Big up Charmeleon. I'm gonna do a big old screenshot on this because that's a bit of a win. I don't know whether you can see that, but that's a screenshot for the archives. Nice. Alright. let's do this last question and probably destroy this Caterpie. We might have to. Yeah, still saying Charmander, so we might have to close out and. Right, young adult female severe acne. Juxta-articular osteoporosis. Osteosclerosis, several vertebrae. I can't concentrate, I'm so gassed about. Charmeleon. This sounds like Ankspond. I'm gonna say psoriasis. Sappho is the hyperostosis, isn't it? Let's find Sappho. I don't think it's got a female predilection, but if it does, I will add that back in. Mixed. C. Isotope bone scan, CT chest, and 3 sequence over. D. Or Caterpie. See you later. I'm so close. I've only got 15 left. I may as well just plod on. And then I can do the restart after you kill the Caterpie. This is good mimicking of the like last 15-20 minutes of the real exam, when your like brain checks out and you start getting more wrong. So let's try not to let that happen. What's the most likely diagnosis? Ectopic urethral, simple urethral, TCC at the vesically uretary junction, urethral edema due to impact bladder diverticulum. Recurrent UTIs in a 26-year-old male. Excretory urography. IVP demonstrates early filling of a bulbous. Radiolucent halo. Prominence of a single. Sounds like a stone. Cystic mass at the right. Simple urethral cell then maybe. Let's go back to that slightly poor one, but with the just do. It's not a cobra. In that picture, it's not a cobra, is it? Maybe I'll just do a couple. What's the name they give for it? Spring onion cap. Nice, spring onion appearance. We're going ham. This one looks really Someone's, I don't know how they've done that, but it's like a myth or something. Continuity of the duplex kidney. Caterpie. Let's hope so. Nice. Okay. Let's close Anki. You don't mind about the meal. Ooh, cancel. Let's sync it. Let's reopen it. Ta-ta. Okay, nice. So what we got? We got 14 questions to go. And it's not updated. Yeah. I'm not bothered. I'm not that bothered. I'm a little bit bothered. 14 questions left. Come on. 7-year-old boy, mild exertional shortness of breath. Chest X-ray has been carried out to show normal lungs, but does demonstrate a linear density, passing inferiorly to the right hemithorax. Inferior from the right lower hemithorax. Sounds like scimitar. What's scimitar syndrome then? Right atrium instead of left atrium. Which of the following best describes radiological findings of UTI malakoplakia? Yellow. D. I guess there will be filling defects if they protrude. 10-year-old boy presents with left hip pain. Perthes Sufi. Age. Having not slipped. I'm not even on peds, I'm on like GU section, right? I don't know. Widened physis, irregularity of the physis, sclerosis of in the region of the femoral neck. Sclerosis. I guess with AVN you get 32 man high-speed traffic accident chance. High running prostate. Vulva. Membranous. Goldman type 3 urethral injury. The junction of membranous vulva. Ten left. 45, increased shortness of breath, long haul flight. Mitral. If you've got mitral regurg, you're going to get a bigger left atrium. See. 60 female driver. B. Dry cough, shortness of breath, 20 years old. She's got sarcoid. Three millimeter parenchymal nodules. Probably stage 2. That was right, I think. I pressed the button twice by accident. We've already done that. But... Stage waiver. Do, 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 do. It's literally the last new question. Okay, 6. Boy, ED. Abdominal pain. Joint pain. Palpable lower limb pura. Holistic pain. Oh, that's so random. Of course it is. Could be. Ascites. I've got HSP then. So the Fort 2 orbital wall. The Fort 3 lateral orbital wall. Left apical pleural cap. Stage 2 sarcoid. Finish him! Now in sync. Okay. That's that for today. What an absolute session. 6.5 hours. Let's call it a day. We got to Charmeleon, and we're one step closer to getting to Charizard and all the knowledge that come with it.